Josh Fenton, CEO and co-founder. Busy morning here. We've obviously had a nice Skype in from Italy with Rebecca Cotto da Silva, giving us updates on what's going on in Europe. And then down to University of Virginia's chair of the political science department, Jennifer Lawless, giving us an update on what's going on in DC relative to the presidential campaign as well as the stimulus package and what her expectations are coming out of Congress, when it will happen and how big it will happen. Now let's go to Dr. Michael Fine, former Rhode Island Director of Health. Dr. Fine, thanks so much for joining us.
Hey Josh, nice to see you.
You had a day off yesterday. You get to go on vacation. Did you travel far? Europe, Asia?
All the way to the back lawn.
Let's go to it. Today's numbers are not up. Yesterday's numbers were up a little bit here in Rhode Island. We seem to be in the 70 range of new cases every day. How are you feeling about the trends?
Oh, it's sort of hard to measure. I think we are gradually creeping up, and that's what I'm worried about. You know, I don't know if and when we hit a tipping point. I hope we don't. And, you know, I think what I'm worried about is that things are sneaking up, not sneaking down. I'd love it if they were sneaking down and we were keeping disease to a minimum, but I don't think we're there yet. And watching what's happening around the nation and around the world is very troubling.
The numbers in the country are, let's go there first. 1,000 deaths yesterday, or in the last 24 hours, 1,400. The day before that, we seem to be back to that 1,000, that evil, awful 1,000 numbers nationally. In hot spots around the country, southern Florida, key parts of Texas, they're worried that they haven't even started to feel the number of deaths because those folks are just going into hospitals now and are in ICU units. Is that the right analysis?
Yeah, the number of people in the hospital, you know, the number of people in the hospital tells you how many people have severe disease. And then you can do the calculations from that, how many people are likely to end up in the ICU and how many of those are likely to die. You know, it's those numbers that are more important if you're into prediction than the number of cases, because the number of cases has to do with who you're testing and the age of the people tested, much less predictive of outcome in this disease, which for most people is not a severe disease if it's symptomatic at all.
The hot spots are still hot spots. The states in the Northeast still continue to be, I don't want to say dormant, but aren't seeing significant increases. Airports are still open. Travel is still going on. Is there a magic bubble over the Northeast? Is there something we just don't know? Why we're being spared during this period of time? Not completely spared, obviously. There's still tragic infection. There's still tragic number of deaths. But as a proportion and in relative impact to those other portions of the country, why are we blessed?
Well, history will answer that question. And I think we got to sort out whether it has to do with our incredible discipline and our adherence to masking and social distancing to the extent we are, probably more than other people, and whether that will stay enough, or whether there's an environmental factor that we can't, that we don't know about and haven't measured yet, that is suppressing disease in the Northeast. Again, 3 to 5 years down the line, we will understand the population dynamics of this, not at the moment.
Yesterday afternoon, I was in Newport driving down Thames Street. Give every tip of the scale, maybe 50% were wearing masks. It is not as densely populated as you'd expect on a mid-July summer day of 90 degrees, but there was a significant number of people out, and you know, mask wearing is still not the norm.
Yeah, and it's people in places like Newport that I worry about in particular because of the fairly large number of travelers. Yes, people are supposed to quarantine, if they come from a number of states with a heavy load of infection. But whether people actually do or not, I don't know, and I don't think we have a way to know or to police that. So we're kind of at the mercy of the good graces of our travelers. Yes, many people are coming and trying to get tested as a way to get out from under the quarantine rules. But remember, the lag time for reporting on testing is now so long that I think most people's vacations will be over before their test comes back.
Yeah, most people's family vacation is neither long enough for a 14-day quarantine here in Rhode Island or waiting for a test to come back here in Rhode Island, which is somewhere around 7 to 10 days, looks to be on average. So that strategy seems to have a few flaws in it, unless they own a summer home or they're Taylor Swift or something like that, who has a new song out about Westerly. Testing here is also in flux. They're closing CCRI as of today, and all the major facility testing has now shifted to a drive-up facility at the Rhode Island Convention Center. Maybe not the most convenient location for people across the state versus when we had testing facilities at URI, CCRI, and Rhode Island College in Twin River. Now it's functionally, those types of testing are now all consolidated to the convention center. Testing is at about a mid-range, around 3,000 to 3,500 a day, nowhere near where the governor said we would be. You've raised concerns about testing and the time lag in being able to get results. What's a person to do?
Oh, continue to be careful. There is one bright spot, and that is, I talk to people who have tested positive every day on the telephone, usually within an hour or two of when they test positive at the rapid testing site in Central Falls. And yesterday, for the first time, somebody from the Department of Health had reached a person I called before I did. And that's really hopeful, that at least for people who are getting rapid testing, they're hearing from the Department of Health quickly. I hope we can keep doing that and make sure that we are in contact with every single person who tests positive as quickly as we can. But again, the problem is, those people who are using the laboratory sites with a longer turnaround for testing. What is a person to do? Isolate at the first hint of a symptom. What I'm hearing about are symptoms that are pretty mild, back pain or a little nausea or a headache, and that's about it for people who have already tested positive, not the classic fever, cough, and loss of taste and smell very much at all. Very, very mild symptoms for people who have already tested positive, and that to me means for the simplest thing, go into isolation first, call your doctor second, get tested third.
Yeah, one elected official in Rhode Island took to Facebook and posted his own message. He had tested positive and was impacted severely, a young guy in his mid-30s, but was hit hard by it and has health effects from it, and posted the video in order to warn others about the concerns about this disease, to take it seriously. Is it in our DNA? Is it ancestral? Why do some people just get crushed by this thing and others asymptomatic or the mildest of impacts?
Again, I don't think we know. My guess is it's a bit of luck, a bit of genetics, a bit of environment, and a bit of what's called viral inoculum, how much of the virus you got into your system at once. And my guess is it's a different mix for different people over time. That's the really hard thing. And the hard thing is that some people get sort of really smashed by it, and some people get nothing.
There's been some anecdotal, or maybe it's a new wise tale, it can't be old enough to be an old wives' tale, that blood type is a factor.
Yeah, and that's part of the genetic piece that I think is yet to be teased out. There are different studies that don't have yet enough consensus to be conclusive about blood type, about, sort of on a certain chromosome, a certain section on a chromosome. But 3 to 5 years from now, we can have a coherent conversation about this. Right now, it's all guesswork. But I'll tell you, what's not guesswork is what other countries that have been successful at keeping this at bay do, and that is to devote many more resources than we have devoted to keeping the virus at bay. Many more public health workers. I've said this over and over again. 42,000 in the city of Wuhan, city of 11 million people. 2,000 in Bnei Barak in Israel, a city of 200,000 people. If we're going to get this under control and keep it there, we got to do way more than just the testing that we're doing.
Yeah, I mean, we've talked about it. We're able to mobilize responses to wildfires across the country, but we can't seem to mobilize healthcare experts and workers to be able to go to hotspots and help alleviate things or pick them off before they become hotspots. It seems to be, and there also seems to be a selfish nature of it, with hospitals and states stockpiling things to make sure that they don't run out in case the disease comes back around to their individual areas. The lack of a federal program, but also a lack of a cohesive narrative between states one to another. Let's go to the global and the national numbers. I believe the United States crossed 4 million positive cases.
Yeah, yesterday I think 4,193,000 positive cases. We have a new version of the $64,000 question. We had a 64,000 case increase with 147,000 United States deaths, ticking along at about 1,000 deaths a day. So by the time the weekend is over, we will likely to have crossed 150,000 deaths in the United States alone. And I think it's, again, reasonably likely that we will hit 250,000 deaths by the Labor Day weekend, maybe by Labor Day, but almost certainly by Columbus Day. And, the problem is, when you think about it from a population perspective, we are unlikely to stop at 250,000. We're likely to be over 1 million by the time this is done, and maybe 2 or 3 million, which is, hard to imagine.
Yeah.
Around the world, 15 million cases plus, almost 10 million recovered, going up by 237,000, 250,000 new cases a day, 638,000 recorded deaths, going up 5,500 yesterday, but 10,000 the day before. Remembering that I don't think that we get very good or accurate reporting from any place other than the advanced nations. But where most of the population is, I doubt we're getting accurate numbers. And I fear, again, that we will not be done till we lose 25 to 30 million people around the world from this disease.
This will be the Spanish flu 100 years later, despite all the developments in healthcare, all the science that we now have. We may have an outcome very similar to what took place in a period of time in which functionally air travel didn't exist, space travel did not exist, cars were at their infancy. 100 years later, we seemed almost equally inept.
Yeah, though, on a pure number perspective, remember that the world population was 1/4 of the world population then. So, we're likely to see many more just because the population is so much larger. But I agree with you. I don't think we've learned very much at all, or develop the discipline we need at all to keep this under control. And there were failures all across the board, every place and every way we can count.
Both the CDC, the White House, I guess it's more than a both, the CDC, the White House, and Governor Raimondo continue to press for in-classroom learning aggressively. The governor had 2 pediatricians on yesterday, one from the Department of Health, saying that the risk for children in the classroom is minimal, that the danger points are different for adults, and that they do not spread the disease as easily as adults do. Those things being said, there's a huge number of faculty members, many of which in many school systems are older, and placing them, 50-year-olds, 60-year-olds, and some 70-year-olds are still teaching, placing them in classrooms, even with certain protections, creates some higher level of risk than them staying at home and teaching. Your thoughts?
Yeah, no, I get the difficulty. I mean, the most important thing we do is educate our kids. And the truth is that the risk to kids is very, very small for each child. The risks to people over 50 are real. And so, one of the things we can't seem to do is figure out a way to approach this differentially by age. I don't know if that has to do with existing law or our custom, but I myself am not comfortable thinking about people over 50 in a classroom right now. Now, I'm also not comfortable thinking about kids not in a classroom. And so how you merge this is a little unclear to me. But I want to just make one small point about children. My colleagues are exactly right that there is minimal risk to kids. But what everybody's got to be mentally prepared for, and this is probably not the most popular thing to say, is that as the number of cases goes into the many millions, we will eventually start to see some pediatric deaths, as we do from flu each year. And everybody's got to look that in the face, because it's a real thing, and you don't want people to be shocked when it happens, when we know that that's what viruses do. We lose 100 to 300 kids a year from influenza. Those are disasters, but they happen, and that doesn't keep kids out of school. So I think it's smarter to start talking about the likely reality that happens, and start talking about that likely reality now. So when we get there, people say, gee whiz, you told us the truth, even though it's difficult.
Yeah, I mean, listen, we trade off risks, right? We transport 100,000 plus children in the state of Rhode Island on buses, and there are accidents every year. And
Yeah.
There's a reality to each of these things, and athletes die on sports fields playing high school sports, and we take many steps to try and minimize those things. I think there's a collective understanding of what the impact is to children, and that there's a limited risk, but there's maybe not enough attention being paid to what the risks are for the faculty members. I mean, we've been trying to build a database of what the average age of faculty members are in schools across the state, and that's slow slogging because in many cases nobody tracks it per se. But anecdotally, it might be 30% of the faculty in different school districts are over 50 years of age.
Yeah, and that's why I'm saying the unpopular and probably the unsayable, which is, why are we not talking about giving those people another option, rather than trying to put them in the schools and hold up education because of those people, when it's the education that's important. I mean, the lives of teachers are important as well, but we can protect those lives by keeping them home, by keeping people over 50 home. So why can't we just look it in the face, deal with it as it is, tell the truth, and deal with the problems in front of us instead of pretending that they're not there.
Dr. Fine, to wrap up, this weekend's going to be 90 degrees, 90 degrees, Monday 90 degrees, Tuesday expected to be around 90 degrees. Hot and humid in the big city and even the little cities like Central Falls and West Warwick. What's your recommendation to folks to deal with the oppressiveness and the unhealthiness of sitting in 90 degree with high humidity? How do folks balance getting some relief and some mental health coupled with avoiding exposure to the virus?
Hydrate, hydrate, hydrate. Wear a mask. Use the lawn sprinkler. I mean, get cool in your own backyard. And, we're Rhode Islanders. So I don't know about you guys, but I go to the beach at 5 o'clock at night. I don't go to the beach in general with the rest of the rebel hordes. So, my guess is if you're going to steal down to the beach, steal down late, stay for a few minutes, breathe in the salt air by yourself, walk on the beach a little bit by yourself with the mask, and then go home and be safe there.
Dr. Michael Fine, thank you so much. Thank you for all your insights this entire week. It is that sort of pensive moment as we track the numbers coming up each day in Rhode Island, hoping that they will stay at the lower level, concerned that they seem to be bubbling up just a tad, and hoping that that's just an aberration. For everybody this weekend, please enjoy the weather, please stay safe, and please wear your mask. Thank you.
Thanks, Josh.